Hi there. Welcome in. My name is Dr. V, and I will be your provider today. Do you know what you're here for? We have you down for just a general assessment and checkup with specifications in making sure we do a cranial nerve exam and a lymphatic system exam. Do you have any other health concerns or thoughts that you want to make sure we look into today? Okay. So I do just need you to confirm a few pieces of information for me. So we'll start with your birthday. Could you please confirm your birthday for me? Perfect. And could you state your name, your first and last name for me? Okay. Thank you. And your preferred pronouns, please. Okay. Just want to make sure we have that correct. Okay, and do you have any specific concerns that we have not gone over that you want to make sure we look into today? Okay. So we do just need to go over a little bit of medical history. Are you currently using any medications, or were you recently prescribed any medications? Okay. Have you received any medical attention for like any surgeries, or have you had any medical issues in general that have brought you to a hospital or an urgent care facility in the recent past? Let's say the past 6 months. Okay. And do you exercise at all? Do you take walks or anything like that? Sure, okay. Perfect. Are you allergic to anything in particular, specifically like any sort of medications or anything that you'd like us to know about? Alright. And how many hours per night do you think you're getting for sleep? How many hours a night are you sleeping? Okay. Perfect. Okay, so that is all of our medical history updating. I do just have a couple of questions in terms of mental health. First, I just want to make sure that you know that this is a safe space, and I will not be relaying any of this information at all to anyone else, so you are more than welcome to share as much or as little as you'd like. I would like to first just ask how you're feeling today, emotionally, mentally. How are you feeling? Okay. And is this a normal state for you, or is this new for you? Okay. Okay. Is there anything that you'd like to mention or talk about? Any sort of concerns or thoughts that you want to mention that you'd feel like talking about? Okay. Well, just let me know if there's anything else, okay? Perfect. So I am just going to start by doing a general vital assessment with my hands. So I am just going to start by putting on my gloves. Okay, so I am just going to take your pulse by putting my fingers up against your neck. Is it okay if I touch you? Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, perfect. Thank you very much. So next, I am just going to take your temperature. So I have my little thermometer here. If you wouldn't mind just opening your mouth for me and saying, "Ah," I'm just going to stick this under your tongue. Okay. And okay. And we are looking totally fine there. Okay, I am just going to take a little light here and look into your mouth and just make sure that everything is looking okay in there, that there are no sores or anything. So there's going to be a light here, and just open your mouth again, please, for me. Just say ah, ah for me, okay? Just say ah. Let's see if we can. There's anything that is. Okay, look all good here. So now I am just going to press around your face with my fingers, just very light pressure, and on your neck, just to check out your sinuses and your lymph nodes that do descend down into your neck and into your armpits, and just make sure that everything is feeling okay here. I will also be feeling for your thyroids, okay? So I'm just going to get close to you now, and I'm just going to press around. Just pressing around. Let me know if you feel any sort of discomfort. Any sort of discomfort. I'm just going to press right up against your orbital bones underneath your eyes. Right underneath your orbital bones here. And right on your brow bones. Right on your eyebrow bones there. Does that feel tender at all? Perfect. Perfect. Okay. Now I'm just gonna go to, this is your chin here. Just making sure that nothing feels tender. How about up here on your jaw? Does this on your jaw feel at all tender? Do you feel like you might clench a little bit? We are feeling a little bit tense up here. Wonderful. Okay, and would you mind just clenching your jaw for me? And clench on the other side. Perfect. Okay. Wonderful. Okay, I am just going to touch your neck down here now with some light pressure. So let me know once again if you feel any sort of tenderness. Let me know if you feel any sort of tenderness at all. And I'm just checking on your lymph nodes down here and on your thyroids. Perfect. Now, if you wouldn't mind just lifting your arms up to the side, I am just going to press on your underarm to make sure that I can feel those lymph nodes as well. So go ahead. Lift them up for me. Very good. Perfect. Everything feels completely normal and nothing is feeling uncomfortable for you. Perfect. Okay. Well, then we're going to go ahead and move on. I'm just going to go ahead and look at the skin on your face and down your neck here and make sure that everything is looking a-okay. Are there any particular concerns that you had for me about your skin? Okay, so I'm just going to go ahead and take this little tool. This is not an uncomfortable tool at all, it's just a little light here, and I'm just going to take a look at your skin and just lightly tap around. Just gonna lightly tap around on your skin here. Okay, looking okay so far. Perfect. Down here on the chin here. Just want to make sure everything's okay down here. And up here. And here. And up here as well. Okay. Up here. Okay. And just up here on your scalp. Just making sure that everything is looking healthy and normal. does look like you have just a little bit of a dry spot right up here on your head, just in your hairline. So I am just going to grab this little cream here and just apply a little bit with my finger and see if we can just soothe that down during the rest of the exam. If so, I'll just go ahead and give you a little free sample of this cream, and let me know if you find that your skin does soothe back down to normal, okay? Alright, so I'm just going to grab a little bit of that and just okay. Does that feel good? Was that a little itchy? Yeah, I thought it might have been. Perfect. We'll put that away. And I will just finish up this skin examination. Just running little lines down your face, making sure I can see all of the little extra portions of your skin that the naked, unlit eye can't see. So, just making sure I'm being thorough here, but everything else looks very good. Very, very good. Okay. Okay. Great. So, now it's time for just a little check on your reflexes. So I am just going to take my fingers and lightly tap different parts of your face, as well as make some gestures directly in front of your eyes, just to make sure that all of your reflexes are functioning the way that we want them to. And I will just ask you to follow my instruction, okay? Wonderful. So I'm just going to place a finger on your forehead here and a light tap. Perfect. And I'm going to place a finger right on your jaw right here. Just a light tap. Perfect. Alright, and I'm just going to snap in front of your face a couple of times. Wonderful. And could you please blink for me? And one more time. Wonderful. Now, I'm going to place my hand on the side of your face, and I am just going to ask that you try and push my hand with your head while I will be putting some pressure back against your face. So just try and push against my hand, okay? And in 3, 2, 1, go ahead and push, 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 push. Perfect. And the other side, go ahead and push, 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 push. Wonderful. Okay, I am going to get quite close to your face and touch your eyelids. I just want to see you please attempt to open your eyelids. I will be holding them slightly open. It won't be uncomfortable, just a very light pressure, okay? So I am just going to hold your eyelids, and I'm going to try and hold them up, and you go ahead and attempt to blink. 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 Perfect. Okay. Very, very good. Your reflexes are looking great so far. And lastly, I am just going to place my hands on your shoulders, and I want you to attempt to just push them up while I attempt to press them back down very gently, okay? Alright, so go ahead and push, 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 push. Okay, and one more time. Push, 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 push. Perfect. You are doing a wonderful job. Everything looks totally healthy and normal so far. So I am just going to go ahead and take these two pencils. This pencil has a soft eraser at the end, just a little soft eraser, and this pencil has just a little hard wooden end, okay? I'm going to ask you to close your eyes, and I will be poking your face with either the soft end or the hard end, okay? And I would just like for you to tell me which one you think it is, the hard or the soft. Alright? Perfect. Okay, so go ahead and close your eyes for me. Just keep those eyes closed. Wonderful. So, here we go. And which was that? Hard or soft? Okay, and now? Okay, and now? Perfect. And now? Okay, and now? And now? Incredible. You got those all correct. You're doing such an incredible job. So, I am just going to assist in a little bit of sinus drainage because you don't feel stuffy, but it does feel like you might have a little bit of pressure. Is that true for you? Would you agree? So I am just going to press my fingers on your two orbital bones right here. And I'm just going to hold them there for a couple of seconds. 1, 2, 3, 4. Okay. Now I'm going to press a little bit further to the side on the edge of the orbital bones on the outside of your face. Okay. And 1, 2, 3, 4. Perfect. Now I'm going to rub the top of your head near your temples, but not on your temples, up here on your forehead, okay? I'm just going to gently hold some pressure and gently rub that area. Okay, and now I'm just going to gently use some pressure to release the fluid down through your lymphatic system, okay? Here we go, and perfect. That'll get things moving a little bit again, okay? Wonderful. So now it's time for your ear exam. I will just be checking on the inside of your ear first to make sure all of the skin in there looks normal and healthy. So I'm just going to take this little pick here again, and I'm going to use it inside of your ear to just look around and make sure all of the skin is looking healthy, okay? So here we go. Just checking for any redness or any sort of skin irritations, any buildup of wax. Just looking around to see if everything's looking okay. I don't get very deep inside of your ear. I just stay on the perimeter, so don't worry about me getting too far or too close to your eardrum here. Just let me know if anything does feel uncomfortable or tender, okay? Okay. And how does that feel right there? Perfect. And over here. Wonderful. And just on the outside of your ears here. Perfect. Okay. Moving on to the other side. Once again, just letting me know if you feel any sort of discomfort or tenderness as I look at your skin on the inside of your ear and your ear canal here. Perfect. Everything is looking absolutely normal and very healthy. So I'm just going to check the outside of your ear, just the perimeter. Perfect. We are looking very, very good. Are you experiencing any sort of hearing problems or loss of hearing, one ear, any sort of sense of vertigo, any balance issues? Okay, perfect. So now I'm just going to take a soft object and a hard object. And I'm just going to have you close your eyes, and I'm going to use them against your ears, and I would like for you to tell me if you can discern when I'm using the hard item and when I'm using the soft item, okay? Okay, so once again, go ahead and close your eyes for me. Close your eyes. Go ahead and close your eyes. Okay, so go ahead and tell me if this is a hard or soft item. Hard or soft? Perfect, perfect. And is this hard or soft? Hard or soft? Okay, and now hard or soft? Hard or soft? Perfect. And now hard or soft? Hard or soft? Perfect. Perfect, perfect. Very good. Now I'm just going to wiggle my fingers next to your ears, and I just would like for you to tell me which ear you hear my fingers in, or which ear you hear my glove sounds in, okay? Keep those eyes closed for me. Alright. And right or left? Okay. And right or left? And right or left? Perfect. And right or left? Wonderful. Right or left? Okay. And right or left? Perfect. And right or left? Perfect. And right or left? Yes, exactly. That was both of your ears. So, you're doing very well so far. Just a couple more hearing tests to go. I am going to now just whisper a word in your ear, and I would like for you to tell me which time I was closer to you, okay? I'm going to whisper the word twice, and I would just like for you to tell me which time, one or two, that I was closer to your ear, okay? Wonderful. Keep those eyes closed for me. Keep them closed for me. And number one or number two? Which was closer? Number one or number two? Perfect. Okay, and now for this ear. Which is closer? Number one or number two? I'll do it one more time. Number one or number two? Which was closer? Number one or number two? Wonderful. And now, using both ears, which is closer? Number one or number two? Number one or number two? Which is closer? Perfect. Very good job. You're doing incredible. I am just going to write down a note here. You did a great job on your ear exams. You did a very good job. Everything seems to be in perfect working order. So now we do have to move on to your eye exam. So to start out for me, I am going to use this little light here. And would you mind please just looking upward for me? I'm just going to examine your eyes and the skin around them. So go ahead and just look up for me. Just go ahead and look up, and just a bright light here and there. and up for me. Perfect. And go ahead and look down. Just look down here for me, okay? And light coming in. And in. And in. Okay. And just look to this side for me. Over here, look to this side. Perfect. And light coming in. Light coming in. Light coming in. Perfect. And one more time over here on this side, okay? And light coming in. Light coming in. And light coming in. Okay. Very good. Now just go ahead and look at my nose for me. Go ahead and look at my nose, and just going to check your pupil reactions. Just checking your pupil reactions here. Very good. Very good. Okay, so we are going to be checking on your eye tracking now. I would like for you to follow my finger around as I do move it, and I am going to be flashing the light behind my finger, and just do not allow your eyes to get distracted by the light, okay? As you follow my finger, I do just want you to use your eyes. Please do not use your head or your neck to move your head about, okay? Perfect. Okay, so go ahead and just follow my finger around. Follow my finger. Very good. And follow my finger here. Very good. And follow my finger here. Just to keep following my finger around here. Very good. And once again, just following my finger, not the light. Following my finger, not the light. And following my finger and not the light. Very good. Now go ahead and just follow my finger. There will not be a light here. Just watch my finger here. Very good. And watch it one more time. Very good. Very good. I am just going to close this eye right here. And bright light. And bright light. Very good. And bright light. Okay. And bright light. Are you feeling any discomfort in your eyes? Is the light too bright for you, or are you feeling okay? Okay. We'll go ahead and cover this eye here. And bright light. And bright light. And bright light. Okay. Very good. Your eyes are reacting in the way that they're supposed to so far. So, I do have two very similar lights here. And I am just going to ask you to look at my nose and keep looking at my nose and let me know when these lights leave your field of vision, okay? We're just going to use our peripheral vision for this, okay? Wonderful. So here we go. When do they leave your vision? Okay. And 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 once more, when do they leave your vision? Perfect. Very, very good. So now I just need to see if you can identify how many times I link these together, okay? So just count with me. Perfect. And how many times? Perfect. And one more. How many was that? Perfect. And here we go. How many was that? Wonderful. So now I'll be using this device and they'll be moving away from you. I would just like for you to tell me when the tip of the tweezers become in focus for you and when they leave, focus for you again, okay? So we'll start close, and okay. Okay. And again. Okay. Okay. And again. Okay. Okay. Now one eye. Here we go. Ah, okay. Okay. And this eye here. Okay. Okay. Wonderful job there. So I do have a couple of eye tests for you. These tests are to help decide if you have any deficiencies in colors when you're seeing. If you have any issues with your rods and cones, we can start figuring that out here. Alright, I would like for you to tell me what shape is inside the circle. Can you see the shape inside the circle? Perfect. And let's see, how about this one? Can you see the shape? The shape might not be right side up. Can you see the shape? Can you see the shape? Perfect. Alright, moving over to this side. Alright, so can you see this shape here? Can you see this shape here? What is this shape? Okay. And this one here. Can you tell me what this shape is? Can you tell me what this shape is? Perfect. So, from beginning to end, there was a butterfly, a sailboat, a music note, and it's a little footprint there. You got them all right. Very good. Very good job. Could you please tell me what shape you see here? What shape is this? What shape is this? Exactly. Very good job. And can you tell me what color this circle is? What color is this circle? Perfect. Okay. And what shape is this? What shape is this? Perfect. Alright, a little smaller now. Can you tell me what shape this is? What shape is this? It's a tree. Very good. And what color is this butterfly? What color is this butterfly? Exactly. It is red. Very good job. You're doing great. Okay. We're getting smaller now. Can you see down here? Can you see down here? Perfect. Can you tell me where the yellow duck is in the line of 5? Is it first, second, third, fourth, fifth? Which one is it? Gotcha. Yep, there it is, the yellow duck. Good job. Okay, and at the very bottom, can you tell me what any of these shapes are? How about this one? What is this shape? Perfect, it's a circle. And what about this one? Can you tell me what this shape is? That's a bird. Very good job. Alright. And between these two lines, can you tell me which one is green and which one is red? Top or bottom, which one is green and which one is red? Good job. Top is green, bottom is red. Okay. I do have to take out my light again here. If you wouldn't mind just following the light this time for me. Go ahead and just follow the light. Follow the light. And follow the light. And follow the light. Great. Once again, just with your eyes. Perfect. Very good. Alright, and I am just going to pass the light over your eyes. Just let me know when the light is the brightest, when it hits its brightest point for you, okay? Okay, here we go. And right here. Okay. And its brightest point. Right here. Okay. And its brightest point. Right here. Okay. And its brightest point. Perfect. Go ahead and close your eyes for me. I do just need to look at your eyelids. I'm just going to check out your eyelids here. Just making sure everything is looking nice and healthy. Very good. And perfect. Okay, and last but not least, I am just going to go ahead and bring this light into your vision. If you wouldn't mind just looking at my nose there and telling me when you can see the light again, okay? Here we go. Okay. And okay. And okay. And okay. And okay. Very good. Very good. Only a few tests left to go. So now we are moving on to your sense of smell, your olfactory sense. And I do just have a couple of things that I will just have you smell, and you will just tell me what sense you smell, okay? There's no right answer to this, so just any sort of scent that you might pick up, just let me know. You can be as vague or specific as you'd like. Alright, so go ahead and inhale. Inhale. And what do you think that smell is? What do you think that smell is? Perfect. Yes, that is cinnamon. That is cinnamon. That is a very spicy, warm scent. Okay, and next. Next, I will have you inhale this scent. And what do you think that scent is? Kind of sharp and citrusy. Mm-hmm. Yes. And what do you think? Lemon. Yes, you are very right. That is lemon scent. Alright, and the last one is a little bit of a spray. So, go ahead and I'm just going to spray this in your direction, and you'll just inhale and let me know what you think, okay? And here we go. Alright, what do you think? What scent is that? It's kind of sweet, smells a little fruity, reminds you of the summertime. Yes, that is strawberry. Strawberry, very, very good. Your nose is working very well. And now we are going to test your taste sense, okay? So I'm just going to place a couple of liquids on your tongue, one at a time, and you will be given specific flavors, okay? And once again, there's no one answer. We just want to see how you're experiencing flavor, okay? So I do just have a little bit of liquid here. And go ahead and just stick out your tongue for me. Say, perfect. And I will just drop that right on your tongue. Go ahead and just taste that for me. Taste that for me. How does that taste? A little salty, very creamy. Yeah. So this flavor is buttered popcorn. Right. Perfect. Okay. And next, I'm just going to go ahead and dab a little bit of this onto your tongue. Like that. And once again, go ahead and taste. Perfect. Yes, this is a little bit more of a potent flavor. It's kind of medicinal, very fresh. Yes, that is mint. That is mint. Okay. And lastly, I'm going to go ahead and get this onto your tongue. Go ahead and stick out your tongue one more time for me. Just right there. Perfect. Alright, go ahead and taste. Wonderful. And very sweet this time, right? Kind of reminds you of childhood a little bit. Yes, this is cotton candy flavored. Perfect. Well, you did a great job on all of your flavors, all of your tastes. Your taste buds are working just fine. And so is your nose, and they're working in tandem very well as well. So lastly, we do just have a couple of comprehension things that we want to make sure that we have done for you. So I have a shape here. You could just tell me what this shape is. It's the shape of an animal. What shape is it? What animal is this? A flamingo. Very good. Alright, and another shape we have here. Another animal shape right here. Go ahead and just tell me what you think this shape is. A cat. Very good. And lastly, what shape do you think this is? What animal is this? Perfect. That is a bear. Alright. Well, we have made it through all of your examinations. You do seem to be just perfectly healthy and doing just fine. I did not find any tender or sore or any sort of places that might need to be looked further into, so you are looking perfect. Do you have any other further questions or thoughts or concerns before I send you up to the secretary? No? Okay, well, perfect. And we'll just take down all of this information here, and perfect. I think you are good to go. Thank you so much for coming in today, and I will see you next time. Bye-bye.